things they're doing now, they're abbreviating so much. I don't know if I'm just ignorant or backwards or what, but a lot of times we have to stop and ask, okay, what is this?
Right.
You know, I think they should spell it out.
You can just say, hey, look, I'd like to have these people come and do an assessment. I've never seen a doctor who wouldn't do that. I've never seen a doctor, I'm not aware of it, that wouldn't do it. I try to talk you out of it or whatever, or just not do it. If you ask a doctor to do something, very often they do it.
Without, I mean, I don't put you on the spot, but why would a doctor not believe in your treatment plan? I mean, in other words, do they just want the person to go into hospice and not do anything, or?
There are probably multiple answers to that, but I can say that years ago there was another facility in this area. Still, it's a rehab hospital, it's still there. Bloodstream. Used to do ventilator weaning. A couple of the pulmonary doctors worked with them, and they didn't like the outcomes of the approach, so they refused. They've drawn it off their whole schedule of thinking. There's also the Richmond, we're conservative values is very good in some places, in some places it works against you. Richmond, no patients except for the VA hospital or on a ventilator, they're all in an ICU except for our hospital and the VA. Most of the country has stepped down vent units for stable patients. And if you go from Fredericksburg north, you'll see it. We get a lot of admissions from the Fredericksburg area, more so than almost any other. MCV and Chippenham, we get a lot of admissions from, but 60 miles away, we see a lot of patients from there. And the reason is they've been aware of this level of care for years and using it up to north. It just wasn't here until we showed up. There are other reasons.
Yeah, I was just curious, because
there's I don't want to,
well, no, I mean, I didn't even know you existed.
There is a situation, I think everybody should be aware of.
Yeah.
I'm not pointing the finger at anybody, but in doctors, but years ago, hospitals went under things called DRGs, and I was the case manager here in 1983. When Chippenham was the last hospital to go under DRGs. Diagnostic related groups.
Thank you.
Which means that they would, that bell curve again, is that if you have a 207 DRG, which means a ventilator, a mechanical ventilation for over 96 hours, that your geometric mean length of stay is 12.5 days. And that's what they base the payment to the hospital on. So if you stay in the hospital for 25 days, the hospital only gets that simple payment. And so they're losing tremendous amount. But guess what? The doctors aren't paid like that. The doctors are paid as long as you stay in the hospital. So 2008 hit a lot of people hard.
So that's probably one reason that they wouldn't send us like to your hospital.
I'm sure that plays into it. I wouldn't want to accuse anybody of doing anything like that financially, so I'm not saying that.
Yeah, you said you have other hospitals. Where is the nearest one other than?
We have Kindred has we have about 120 now.
Yeah, you said.
And the next nearest one is in Greensboro, North Carolina. Charleston, Atlanta.
So that's the only one in the Tri-City area?
This is the only one this is the only long-term care hospital within 70 miles or so.
Oh, okay.
And only one in Virginia is.
Oh, okay.
I thought you had one in Lynchburg.
That's not the Kindred hospital. That's over 70 miles away. We won't mention the competition.
I have a neighbor who brought her brother from Roanoke down here about 4 years ago.
Yeah. So,
But you don't really advertise, do you?
I
You
know,
don't.
I didn't know.
I mean, that's what I'm thinking. I mean, you're always seeing on TV, it's JCA or it's the Bon Secours.
well, they have a different,
But you
that's a
don't
different type of hospital. Ours is a referral-based hospital. So the way we do, they call us marketing. I'm the director of marketing, not really marketing. What I do is education. And and networking and relationship building. So I go to doctors directly, or case managers directly, or ICU managers directly, or those sort of folks, and I talk to them directly about what you provide, consumers, and I talk to you directly about what we do. So it's just not effective. We don't deliver babies, and we don't take care of gunshot wounds.
Right.
So if we get on television and say, we're the big hospital in the corner, next thing you know, people come in and start delivering babies.
That's right.
Yeah, that's true. You're right.
So,
You're right.
actually, by law, we have to deal with it, stabilize people and transport them out.
A lot of it too, I think, the old school is word of mouth.
Word of mouth.
Word of mouth, yeah.
And trying to, get out outcomes. Our focus with everybody in places like Northern Virginia where there are adoptions, is we put our outcomes up against anybody else's outcomes. So we've asked and asked and asked and asked for comparisons, and nobody's given us their comparisons yet. So for bloodstream infections, for ventilator-associated pneumonias, for wounds, for weaning rates, for patient satisfaction. One of the questions we ask in our satisfaction scores is, would you refer a family or friend to Kindred? These are at discharge we ask patients. We've got like 83%, this most recent one is 89% eligible of people saying, yes, we refer a family or friend. That's the kind of thing, my only question really as a person is, if you feel comfortable enough with us, would you have a family or friend come? I think that's a strong.
I just, I'm from Luray. I heard about Kindred went in Luray, but I live in Richmond. And I was unconscious for a couple of weeks, and then I was shipped to a nursing home. Kindred was never mentioned. The family came from Luray and asked me why I wasn't put into Kindred. Well, I have to.
Which hospital were you
go
in?
through.
Which hospital were you in?
Chippenham.
How long were you in the hospital?
31 days.
We're trying to let them know.
4 years ago.
You went to a nursing. How long on a ventilator?
No, they pulled me off the ventilator before I went, because I remember that.
Yeah, it's still 4 weeks. I mean, that's,
And they sent me about
Ideally.
5 hours.
Ideally, about 2 weeks.
Down.
4 or less. You'd have been able to come over and we'd probably gotten to the point where you.
That's the reason I asked, who refers you?
Well, again, we get a lot of support. Not everybody knows or is.
If we know about it ourselves, we can ask that, yes.
That's what I said, yeah.
I just thought it was odd, 3 hours away.
That's
They
right.
know about it, and I live here in Dublin.
Doesn't it start with the case manager?
Not really. Well, it does, yes, no. Doctors.
You have a list of rehab hospitals that patients can go to. Many doctors don't keep up with it.
Well, it has to be a doctor. So.
Right, but she just says here.
Sometimes, it depends on the hospital. Depends on the situation. If you live I will not use any local examples. If you live in Winchester, case managers are very strong. If you live in Mary Washington, case managers are very strong. Doctors very supportive. Duke, no brainer. They know exactly what's good. UVA, not so much. They don't really get it. So.
That's where, I'm sorry. His sister had the same disease that he has. And she had 1 lung transplant. That's what she had done. And she lasted 1 year and 6 months. 6 months? And he was going to the same doctor that was his second opinion. And now, that's why I asked for another referral, one reason. And now he's decided to not have this lung transplant. At first, I support my husband, whatever he says. I don't care, I'll say it. For one thing, he supported me. I had a double mastectomy in April. And he supported me wholly. And I'll support him whatever he decides. But I sorry, I lost my train of thought
No,
now.
well, I hear what you're saying. You know, people do make decisions, and it's important to support people in their decisions. But decisions are best made, in my humble opinion, if you've got full information. If you've got partial information, you
Right.
can make a decision. These guys would be very good to help, get you to a third opinion or a second opinion.
Russell, how many, you've had lung transplant?
Me?
Oh, yeah, he's talked to us about it a lot. He's talked to us about it a lot. So, I had another question though about what you were saying about, because I heard a lot of people say they never heard, which of course I hadn't. And of course, this is our first time being here. But I used to work with Kathy's daughter, totally different place. Anyway, it doesn't matter. Maybe you've done this, like Breath Matters, throw a big get together for the community somewhere.
Breath
And-
Matters is Russell.
Okay, whatever. No, but, and let everybody here, we could all, I'm sorry. I mean, I could let you, but chip in, let everybody bring a dish, but put it out there to the whole community. Print out flyers, and like we did it, the way we did it, and you're not selling anything, and have speakers, you could come, have doctors. We did this, but this was where I did it, they were selling at one point, but then again, they weren't at another point. We had a, yeah. Yeah. No, but we weren't. At one point, we weren't, okay? We had a heart doctor, you may know him, Dr. Morris. Clifford Morris, yes, he was my
See, that's the area we're at, and all the
Yes.
and we had to come out of our area to here to get,
All these-
I shouldn't say it, to get better quality service.
But I'm
See, we had the second get together that we had for the community. There was that we weren't selling anything, and we had bouncing things for the children,
Well,
Yeah,
I can feel that the hook is coming around my neck.
Okay. Time close.
I think we're getting to the end of our time. Does anybody else have a quick question? Otherwise, you got my card. Yes, ma'am.
Is this more or less a rehab? It's not an indefinite stay?
It's not a rehab. No,
It's
we're
not like a nursing home,
we're
though.
more like an ICU or a step-down hospital, critical care.
But you
We're,
stay there
this is what we are.
for a long time.
People's medical problems are here, and their functional rehab problems are here. Our goal is to push the medical problems down, so the functional ones are the biggest problem, and then we transfer people to a rehab hospital, to a home with home health, or skilled nursing.
And continue on with your life.
It's a continuum of care.
Yeah. Well, thank you so much.
Thank you for having me.
Have